Picture this. You're 72, still active, still independent, and one morning you swing your legs out of bed, stand up fast, and the room tilts. That moment has a name, and for millions over 60, it's tied to blood pressure. Here's what I'll show you today. You know this feeling, even if you've never named it. You wake up, you head for the bathroom. You stand, maybe a little too fast. And for 1 second, or 3, or 10, you don't feel steady. Your head feels light. Your vision gets a little gray. Your body feels slow to catch up. And because it passes, you brush it off. You tell yourself it was nothing. Maybe you slept wrong. Maybe you're tired. Maybe you just need coffee. That's a very common thought. And if you're over 60, it's completely reasonable to wonder whether this is just part of aging. A lot of people do. Picture someone in this situation. This is a composite of common cases. A 69-year-old retired school teacher, still gardening every morning, still driving herself everywhere, still proud of needing very little help. She gets out of bed, feels a quick wave of dizziness, puts a hand on the dresser, waits a few seconds, then keeps moving. She doesn't faint. She doesn't fall, so she never mentions it. That's how this problem hides. Not because you're careless, because the moment is short. A lot of morning problems don't arrive like a siren. They arrive like a shrug. You stand up. Your balance feels a little off. You grab the wall. You take a breath. Then you move on with your day. Maybe it happens after you've been in bed all night. Maybe it happens when you rush to the bathroom. Maybe it happens before breakfast, before water, before your body feels fully awake. And the reason people miss it is simple. The body often recovers fast enough to make the warning look small. But small warnings matter. The National Institute on Aging said in 2022 that more than 1 in 4 adults age 65 and older fall each year. That doesn't mean every brief dizzy spell leads to a fall. It does mean balance, blood pressure, and timing matter much more than most people think. The same NIA guidance says blood pressure that drops too much. When you get up from lying down or sitting, what they call postural hypotension raises fall risk. And they give one very plain piece of advice. Stand up slowly. Now listen to how easy it is to dismiss that. Stand up slowly. It sounds almost too simple, too ordinary, too small to matter. But this next part is where the video turns. Because the issue isn't only that you stood up. It's what your circulation had to do in that exact moment to keep blood moving to your brain, your heart, and the rest of you. And if that system is slower than it used to be, or if your medicines, hydration, sleep, or meal timing are getting in the way, your morning routine can become a setup for dizziness, near falls, and blood pressure swings. I'm Jason Ford. On this channel, I review published research on senior health and translate it into plain English. The part a 15-minute appointment often doesn't have time to walk through. Before we go deeper, drop 2 things in the comments: your age and the city or state you're watching from. I read every comment on this channel. It changes what I make next. Take 5 seconds, drop it below. I'll wait. And stay with me, because in a few minutes, I'm going to give you 4 morning steps. Number 3 surprises people the most. And number 1, almost nobody talks about. Let's make this simple. Think of your bloodstream like a set of garden hoses running through a 2-story house. When you're lying down, the water pressure is more even. Then you stand up, fast. Gravity pulls blood downward, toward your legs and belly. Your body has to respond right away, or your brain gets a brief dip in blood flow. That's when you feel the wobble. Mayo Clinic explained in 2022 that orthostatic hypotension, also called postural hypotension, is low blood pressure that happens when you stand after sitting or lying down. Symptoms can include dizziness, lightheadedness, blurry vision, weakness, confusion, and fainting. Why does it happen? Your body has built-in pressure sensors. Mayo Clinic says special cells near the heart and neck arteries sense when blood pressure drops. They signal the brain. Then the heart beats faster, blood vessels tighten, and pressure comes back up. That's the design. But age changes timing. Mayo Clinic says this is more common at 65 and older, partly because those pressure sensors can slow down with age, and partly because an aging heart may not speed up as quickly to compensate. Now add real life. Maybe you didn't drink much water yesterday. Maybe you had alcohol the night before. Maybe you're taking a diuretic, or a beta blocker, or a calcium channel blocker, or nitrates, or another medicine that can affect pressure and circulation. Maybe your bladder is full, so you jump up fast. Maybe you've got diabetes, which can affect the nerves that help control blood pressure. Maybe you slept hot, woke up dry, and your blood volume is a little low before your feet even touch the floor. One body, many moving parts. The CDC's steady handout on postural hypotension, published in 2017, says symptoms can happen when you stand or sit up suddenly, in the morning when blood pressure is naturally lower, after a large meal or alcohol, during exercise, when straining on the toilet, or when you're ill. Read that list again in your mind. Stand suddenly. Morning. Large meal. Alcohol. Straining. Those are not rare events. Those are daily life events. Now layer one more piece on top. Your blood pressure also has a morning rhythm. Research has long noted that heart and stroke events cluster in the morning hours. In a 2003 study published in Circulation, researchers followed 519 older adults with hypertension. The people with the highest morning blood pressure surge had a 19% stroke incidence during follow-up, compared with 7.3% in the others. Their relative risk remained significantly higher even after matching for age and 24-hour blood pressure. That doesn't mean every morning surge is dangerous. It does mean mornings are not neutral. For some people, blood pressure rises too sharply after waking. For others, it drops too much when they stand. And a lot of older adults can have pieces of both storylines at different times, depending on medication timing, hydration, sleep, illness, and underlying heart or nerve issues. That's why this gets confusing. You can feel dizzy from a drop. You can also carry hidden risk from a surge, and both can live in the same morning window. Now, if you're thinking, fine, but how common is this really? Fair question. A 2020 systematic review indexed on PubMed found orthostatic hypotension is very common in older adults, affecting about 1 in 5 community-dwelling older people and almost 1 in 4 older people in long-term care. 1 in 5. That is not a fringe issue. An American Heart Association news report in 2020 also described orthostatic hypotension as occurring in 5% to 30% of people over 65, and it highlighted research linking dropping blood pressure on standing with frailty and falls in older adults. So when a cardiologist or geriatrician or careful primary care doctor tells you not to spring out of bed in the morning, that isn't old-fashioned advice. That's circulation advice. There's one more reason people get fooled here. The symptom is short, so people think the cause must be small. Not true. A 3-second signal can still point to a real pattern. Think of the check engine light in a car. The light itself is small. The thing behind it may not be. Same idea. And here's where most people get it wrong. They assume the fix is just to be more careful. Be careful helps. But careful is not a plan. You need a morning system. And before I give you that system, one quick point on measurement, because this is the part families often miss. The American Heart Association says that when you measure blood pressure at home, you should avoid caffeine, smoking, and exercise within 30 minutes, empty your bladder, sit quietly for at least 5 minutes, support your arm at heart level, and take 2 readings 1 minute apart. Why does that matter here? Because a lot of people check blood pressure after rushing, after coffee, after talking, or while half standing at the kitchen counter. Then they get a number, but not a clear picture. Data matters. Good data matters more. If this is useful so far, subscribe. I do one deep dive like this every week, built for people who want calm, sourced explanations, not noise. Now let's get practical, because knowing the mechanism is helpful, but it doesn't protect you tomorrow morning unless you change what you do. Here are the 4 steps I'd want you to remember. And number 3 is the one that surprises people, because it starts before you even stand. Number 1 is the one almost nobody treats like a real intervention. Step 1. Build a 10-second pause between waking and standing. Not an hour. Not a ritual. 10 seconds. When you wake up, don't launch upward. Roll to your side if that feels easier. Sit up. Let your feet hang over the edge of the bed. Move your ankles up and down. Open and close your hands. Take 1 or 2 calm breaths. Then stand. That tiny pause gives your pressure system time to catch up. The CDC's 2017 steady guidance says to get out of bed slowly. First sit up, sit on the side of the bed, then stand up. It also suggests gentle movement before getting up, like moving your feet and clenching and unclenching your hands, or marching in place after you stand. Simple, practical, free. And if you use a cane, walker, or furniture for balance, have it where you can reach it before you stand. The goal is not to prove you're still quick. The goal is to stay steady. Here's what to ask your own doctor if this step seems to help, but not enough. Ask whether you should be checked for orthostatic hypotension with blood pressure measured lying down and then standing. Ask whether your symptoms could be related to medicines, dehydration, anemia, diabetes, or another condition that needs direct evaluation. That last part matters. Because standing slowly is helpful. It is not a diagnosis. Step 2. Stop guessing. Measure your blood pressure the right way and write down patterns. Not just one number. A pattern. The American Heart Association's home monitoring guidance says to plan ahead. Avoid caffeine, smoking, and exercise for 30 minutes before measuring. Empty your bladder, sit quietly for 5 minutes, and take 2 readings 1 minute apart at the same time each day. That means if you want a clean morning number, coffee has to wait. A lot of people over 60 do the opposite. They wake up, hurry to the bathroom, pour coffee, start moving around, maybe talk, maybe scroll their phone, maybe worry. Then they check pressure. That reading may still tell you something. It just may not tell you what your body was doing at baseline. What you want is a clean window. If you and your doctor are trying to sort out dizziness, morning spikes, or medicine timing, clean data is gold. And here's the shareable moment in this whole video. A blood pressure reading is a snapshot. The American Heart Association says a record of readings taken over time gives a more complete picture. A snapshot versus a pattern. That one idea changes how families handle blood pressure at home. So write down what time you woke up, whether you felt dizzy, whether you had coffee, whether you had symptoms after standing, whether you had just eaten. Then bring that to your doctor. That's useful medicine. If you've ever noticed your symptoms are worse before breakfast, or worse after coffee, or worse when you get up to urinate at night, tell me that in the comments. Those little details help other people realize they're not imagining it. Step 3. Look at hydration, meals, and medicine timing with fresh eyes. This is the one people don't expect, because many older adults assume their morning problem starts in the morning. Sometimes it started the day before. Mayo Clinic lists dehydration as a cause of orthostatic hypotension. The CDC handout says symptoms may show up after alcohol, when you're ill, or when you stand suddenly. Harvard Health also notes that getting out of bed is a common trigger and recommends fluids through the day, with care rising from bed. So think backwards. Did you drink enough yesterday? Did you sweat a lot? Did you have alcohol? Did you have a heavy evening meal? Did you take a medicine at night that leaves you dry or more pressure sensitive by morning? Now, do not change dosing on your own. Don't move blood pressure medicines around because a video mentioned timing. Talk to your own doctor or pharmacist first, but do ask the question. Ask whether any of your medicines could be contributing, especially diuretics, alpha blockers, beta blockers, calcium channel blockers, nitrates, or other drugs that relax vessels or shift fluid. Ask whether the timing of those medicines makes sense for your symptoms. Ask whether your morning dizziness could be linked to low pressure after standing, or whether your doctor is more concerned about high early morning pressure and wants more monitoring. Same symptom window, different possible problem. This is why guessing is dangerous. Picture someone in this situation. Another composite of common cases. A 74-year-old retired mail carrier, still walking his dog twice a day, starts feeling shaky each morning. He blames age. Later, he realizes the worst days come after poor sleep, little water, and rushing out of bed because he has to urinate. That pattern gives his doctor something to work with. Patterns lead to answers. And if you have a parent or a spouse or a friend this applies to, this is worth 60 seconds of their time. Send it to them. Step 4. Know the red line symptoms that change this from watch it to call. This step matters most, because not every dizzy morning is routine. Mayo Clinic says fainting, confusion, blurry vision, and weakness can occur with orthostatic hypotension. The American Heart Association says blood pressure readings over 180/120 with symptoms like chest pain, shortness of breath, back pain, numbness, weakness, change in vision, or trouble speaking can be a medical emergency. So if your symptoms are repetitive, worsening, or coming with anything more serious than a brief wobble, don't sit on that story for months. Ask your own doctor whether you need prompt evaluation. And if you have chest pain, trouble speaking, one-sided weakness, severe shortness of breath, or a blood pressure emergency with symptoms, seek urgent care right away. That's beyond self-monitoring. One more rehook before we move on. The biggest mistake families make is treating dizziness like a personality trait. Oh, that's just how mom is when she gets up. No. That may be a circulatory clue. Clues deserve follow-up. Now, I want to answer the question I know is sitting in your head. Isn't this just getting older? Here's the honest answer. Aging changes the system, but aging alone is not the whole story. Mayo Clinic says age 65 and older is a risk factor, yes. The pressure sensors can slow down, yes. But dehydration, medicines, diabetes, heart problems, nerve problems, alcohol, bed rest, and meal timing can all play a role too. So, I'm older is not a full explanation. It's a starting point. Another common objection is this one. I've always gotten up fast. I'm fine. Maybe you are. But the body you had at 45 is not the body you have at 72. The margin gets smaller. The recovery can get slower. And the consequences of one bad morning, one fall, one blackout, one bathroom rush in the dark can be much larger. That's why people who feel mostly fine still benefit from paying attention. Let me name the sources one more time, because you deserve to know where this comes from. The National Institute on Aging updated fall prevention guidance in 2022 and said more than 1 in 4 adults 65 and older fall each year. It also warns that blood pressure dropping too much when you stand can raise fall risk. Mayo Clinic updated its orthostatic hypotension review in 2022. That's where the explanation of symptoms, causes, age-related changes, and medication links comes from. The CDC study program published a postural hypotension handout in 2017. That handout is very plain, very practical, and it specifically says symptoms may happen in the morning and when you stand or sit up suddenly. The 2003 circulation study followed 519 older adults with hypertension and found that a high morning blood pressure surge was linked with higher stroke risk. An American Heart Association news report in 2020 summarized research linking blood pressure drops on standing with frailty and falls in older adults. And a 2020 systematic review indexed on PubMed concluded orthostatic hypotension is very common in older adults, about 1 in 5 in the community and nearly 1 in 4 in long-term care. That's the evidence floor for this video. Now the limits. There are situations where you should call your doctor today. Not next week. Today. If you're fainting or nearly fainting more than once. If you're having repeated morning falls or near falls. If dizziness comes with new confusion, unusual weakness, or blurry vision that doesn't clear fast. If symptoms started after a medication change. If you're seeing very high blood pressure readings, especially with symptoms. And if you have chest pain, shortness of breath, trouble speaking, or one-sided weakness. Seek urgent medical care right away. Those are outside the scope of a video like this. They need direct evaluation. Let me run through the core points quickly. First, standing up too fast in the morning can expose a blood pressure problem you didn't know was there. Second, brief dizziness is easy to dismiss, but repeated patterns matter. Third, mornings are a unique window because blood pressure can either drop too much on standing or surge too sharply after waking. Fourth, the best home move is simple. Pause, sit, move your feet, then stand. Fifth, clean blood pressure tracking beats random guessing every time. Here's the whole message in one sentence. If you're over 60, your morning routine should work with your circulation, not against it. If this helped you see something new, subscribe. Next week, I'm walking through why morning walks help some people over 60, but leave others wiped out by noon, and the reason often starts with blood pressure, hydration, and timing. And in the comments, I'd love to hear this. Have you ever felt lightheaded when you first stood up in the morning, and did you ever bring it up to your doctor? Take good care of yourselves. I'll see you next week. But there's one thing I still haven't told you, and it's the reason a healthy morning habit can feel great for one person and draining for another. That's where we go next. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.